It's been 2.5 years since Frances Rossi experienced the first in a string of strange symptoms. It began as a bad head cold.
It was mainly just this, real awful sinus. And then I completely lost the middle part of my voice, and that's never happened before.
Rossi suspects she may have been infected on a light rail train.
The cars are packed. I mean, you get on and you squeeze into the door and hope you can get in.
Or perhaps it was one of the choirs that she directs.
I started having the dizzy spells and the mental, the fogginess. My heart would be pounding, and I had blood pounding in my fingers and in my toes, and just odd symptoms that were really alarming.
An antibody test several months later revealed she'd had COVID-19. Time spent in a Facebook support group made her realize.
The light went on finally, and I thought, other people are having the same thing. It's COVID that lasts.
The U.S. government estimates between 7 and 23 million Americans currently suffer long-term effects of COVID-19. 1 million of them can no longer work. The reality is the extent of the condition is as elusive as its cause. Rossi is enrolled in a study here at University of Colorado Hospital that aims to find out why some people in the population are more prone to get long COVID than others. Some other questions national researchers hope to answer. How do people recover from a COVID infection? And how has long COVID changed over time?
There's a little bit of data suggesting that it may be less with some of the newer variants and among patients who have been vaccinated.
Feel good?
For several years, specialists in UC Health's post-COVID clinic have operated somewhat in the dark, not always sure which treatments work. They've learned to use a slower, more graduated approach to physical rehabilitation, for example. Data generated by thousands of patients in the RECOVER study will help.
We can look at the breathing test, we can look at the blood, we can look at the symptoms and put the full story together in a way that we haven't been able to before.
Dr. Sarah Jolly's clinic has a several-month-long waiting list for new patients, which is why, she says, educating more medical providers about long COVID will also be critical in the future.
I think our amount of knowledge we learn from the RECOVER study will be huge, and it will continue to come out for many, many years.
Rossi, who still has symptoms, will be studied for 4 years.
I think it's very important that we come to understand this condition and to see the reality of it. At least maybe now we'll get some information that will show us what's going on.
Hendrik, Sybrandy, CGTN, Denver.